So good morning. Welcome to EM Talk. This is going to be a journey over the next 4 hours, and you are pioneers, and so we are thrilled that you're here. I wanted to first of all introduce kind of the group that's supporting you today. So I'm Eric Isaacs. I'm from San Francisco, and I'm going to perhaps have everybody introduce themselves.
I'm Maureen Gang, currently at Rutgers. I don't do palliative care. I have mostly an administrative role, but I do think this is really so integral for whenever I am on the floors. So just happy to share my knowledge with you, which is a little bit.
Good morning. I'm Joanne Kuntz. I am emergency medicine and palliative care at Emory University. And we are delighted that you guys chose to enroll in this course.
Hello, my name is Marie Carmel Ellie. I'm faculty at the University of Florida. I'm also an emergency physician, and I specialize in critical care and palliative care. And I'm also extremely honored to be here to be working with all of you today.
So we have a couple other people who have taken this course before and are going to be instructors, and so are also here in a supportive role. And Kei Ouchi.
I'm Kei Ouchi. I am an emergency physician at Brigham and Women's in Boston, and I'm looking forward to helping in any way that I can here.
And then Naomi.
Hi, Naomi. I'm an emergency and critical care fellow at Brigham as well, and I've taken the course and learning more and trying to help out.
So you heard some talk about palliative care, and while the faculty all have an interest in palliative care, this is not really just a palliative care course. It sort of lets you know where the roots came from. This course is modeled after Vital Talk, which is a way of teaching communication skills. And it started by teaching communication skills for patients with serious illness and to help with difficult conversations. And over the many years that they've been doing these Vital Talk courses, they found that different specialties had slightly different needs, different scenarios, different problems, different preferences. And so over the years, they have developed Onco Talk, Nephro Talk, Intensi Talk. Well, we are now EM Talk. And the philosophy is, the philosophy that I bring to this is that we have difficult conversations every single day. We're delivering bad news. We are talking with patients who are challenged in many different ways. And if we had tools to sort of organize our conversations and tools that can teach us a little bit about communicating, it helps with every single patient that we see. And the other philosophy that I think that hopefully by the end of the day you'll go home with is that when you think about communicating with people, people communicate really on two levels. They communicate on a cognitive level, which is what we've been doing for years and are really good at, and people communicate on an emotional level. But the problem is that the brain, the way the brain is set up, emotions trump cognitive. And you've seen this all the time. You see this all the time, that when you get emotional, it just overtakes your cognitive abilities. When you're communicating with people, though, you can't really get to the cognitive stuff until you deal with the emotional stuff. And so hopefully today you're going to get a taste and develop some skills to recognize emotions when they're happening, and we're going to give you some tools to deal with those emotions, address the emotions, express empathy, and then be able to communicate what you need to communicate much better. So that's our goal. In your packet.
Can we?
Yes.
Can
Sorry. Go ahead.
Can we just ask who they are?
Yes.
Since we all introduced ourselves, and I'll just pass this around. So just tell us, like, one sentence, where you're from and why you chose this course.
So my name is Chris Richardson. I'm coming from Mount Sinai in New York. I'm actually a palliative medicine fellow there now, and I've done the Jerry Talk version of this course as part of the fellowship, and I was interested. I'm going to be on EM faculty starting in the summer, so I'm interested in sort of the emergency medicine applications.
Good morning. I'm Ellie. I'm a resident, first-year resident in Maimonides in Brooklyn. This interested me. I'm coming from a hospital where there's a very aging population, very religious population. So always a very difficult conversation to have, and what I'm looking forward to having. An old religious population.
Where are you?
Maimonides.
Oh, Maimonides in New York.
Yeah.
I'm Jack Ludwig. I'm one of the R2s at University of Washington Harborview up in Seattle. I took this course because, as you can imagine, end of R2 year, a lot more responsibility, a lot more being left in room to have these conversations on your own or in the ICU, et cetera. And never really had any formal training on it, so we'll see what happens.
Welcome.
My name is Zachary Hollins. I'm a M3 at the University of Kentucky. And although I'm not 100% sure what I want to specialize in yet, I understand that no matter what you choose, you're always going to have difficult conversations that are going to be emotionally charged, and I feel like this was going to give me some tools that I could use to navigate those conversations with.
Well, you're all ahead of the game by recognizing that. So.
My name is Sarah Q. I'm also an M3 at University of Kentucky. Same thing, kind of what Zach said. I feel like this is going to give me the tools I need to have the conversations in the future as an EM physician.
Ashley Flam, also an M3, I'm just following down the line, at UK. I suppose that I've seen difficult conversations play out in my life well and not well, so I'm interested to see what it goes into because I know that I'm going to have to deal with it too. So.
And then our student ambassador just let her just say something.
Okay. I'm Alex Holmes. I'm, I guess, an old. I'm a rising intern. I'm going to be in Carolinas in Charlotte. And I guess, I mean, I didn't realize until now, but we put our interest in as an MSA, and one of my interests is palliative medicine, and so I think that's probably why I was assigned your session. Part of our curriculum in medical school was on like difficult conversations and emotional intelligence and stuff like that. So,
Awesome. Well, welcome.
Great.
All right.
So we are going to, I think, have some time in the small group setting. We're going to get into small groups shortly to sort of explore other interests and fears and things like that.